So good morning and thank you to the organizing committee for this invitation to speak to you this morning. I am tasked to discuss diagnosis and management of atypical pathogens, and I will concentrate primarily on Chlamydophila pneumoniae and Mycoplasma pneumoniae. We know that whenever we get a respiratory tract infection, we usually go through the process of doing relatively non-specific tests in the form of doing your CBCs, ESR, CRP, and chest x-rays. But are these tests really helpful in making a diagnosis of an atypical type of pneumonia? If we take a look at the WBC counts of patients with Chlamydophila and Mycoplasma pneumoniae, the results are usually either normal or only slightly elevated. If you do your ESR, which is a very non-specific test for inflammation, you will see elevated values. And if you do your chest x-ray, whether it's for Chlamydophila or Mycoplasma pneumoniae, the findings are usually non-specific. For example, if you take a look at the findings for Chlamydophila, you will see alveolar or patchy infiltrates. You may see subsegmental pneumonitis, meaning you will just see very minimal streaky infiltrates, and the usual findings of consolidation and pleural effusion are usually not seen. If you take a look at Mycoplasma, the common description that you will read in literature is the presence of bilateral diffuse reticular infiltrates. I'll show you a plate in my next slide, but others will also show the other findings like lobar pneumonia. You may see streaky instead of patchy infiltrates. You may also see consolidation, and you may see a small effusion. This X-ray typifies the usual Mycoplasma pneumoniae X-ray, wherein you will see some very minimal infiltrates here, minimal effusion on the left, but no consolidation and no other findings. You may also see hilar adenopathy. Please be reminded that this finding is a non-specific one and can be seen in any infection affecting the respiratory tract. For us to make a definite diagnosis, we need to make or utilize specific tests to look for either the antigen itself or to look for evidence that we have been infected with this pathogen. Usually, we resort to looking at antibodies because it is very hard to either isolate the antigen itself by direct smear, or it takes some time, or it may require special cultures for you to be able to detect the antigen itself. For Chlamydophila pneumoniae, there are no commercially available diagnostic tests, cheap ones, fast ones, to make a diagnosis. In literature, it has been said that it is only the microimmunofluorescence antibody test which is accepted as a test to make a diagnosis of Chlamydophila. It is the most specific and the most sensitive, and they recommend that you should demonstrate a 4-fold increase